Hi, everyone. Thanks so much for having me today. I'm Gabrielle Schmitt. I am the Assistant Director of Enrollment and Specialty Care at DSCC. And DSCC is actually a well-kept secret. We are statewide. We help kids and youth with special health care needs in Illinois. And our mission is basically just to partner, help, and connect. So, partner with Illinois families and communities to help children and youth with special healthcare needs connect to services and resources. As I mentioned, we are a statewide program. We have served kids with special healthcare needs and their families since 1937. We are the Illinois Title V organization, also that serves kids with special healthcare needs. And in fiscal year 2025, we served all 102 counties and close to 14,000 families. These are our regional office maps. It's basically just to show you that we have offices all over the state. So we do have a couple different programs, which I will talk to you a little bit about. We have centralized our enrollment. So if you have a referral, if you want to refer a family, if you know of a family that wants to refer themselves, I'll get into how we can do that. But we do have staff locally for all those families because our care coordinators do know a lot about those local resources. So, care coordination sounds very similar to what Julie just described. So, we are person-centered and family-centered, strength-based, and assessment-driven. Our care coordination is tailored to each child and family, and it is free for all DSCC participants, regardless of family income. So, in order to qualify, a child has to have a medically eligible diagnosis for our programs, and I'll talk about those. But regardless of income, care coordination is free. Our core and connect care programs do offer some financial assistance for specialty medical care, and in those programs, a family does have to be financially eligible in order to receive the financial assistance. Our care coordination teams, we have nurses, social workers, speech pathologists, audiologists, respiratory therapists, and our health insurance specialists. We rely on them a lot for help to make sure that our families are maximizing their health insurance to make sure that they're paying the premiums. We want to make sure that our families are being able to take advantage of their insurance. So how does care coordination help? Our care coordinators communicate with the doctors, specialists. Our care coordinators can also attend medical appointments, IEPs. We do quite a few home visits. If families are having a hard time understanding maybe what the treatment plan is or how to even get started on a treatment plan that maybe one of the physicians has recommended, we can help kind of navigate that with the family. We can assist with transportation to medical appointments. We connect families for parent-to-parent support. We locate community resources. And like I mentioned, we can pay for some eligible medical expenses if a family meets our income guidelines. So we have a few different programs. Our Core and Connect Care programs serve ages birth to 21 for children who have medically eligible diagnoses. Really, the only difference between the Core and Connect Care programs is that if in order to be part of the Connect Care program, a child already must be in a Medicaid managed care. So our Core program, any kind of insurance is fine. So basically the eligibility is all the same. It's just the Medicaid MCO for the Connect Care program. Our home care program provides in-home nursing to children who are medically fragile and technology dependent. And our interim relief program is one of our newest, and that is our behavioral health program. It seeks placement for eligible children, again, under the age of 21 in a psychiatric residential treatment facility. And what that does is it offers services to kids for mental health. So it can be examples of substance abuse, sexual abuse, aggression, eating disorders, personality disorders. Treatment is daily and individual, group, family therapy. And what our program does is we work with the Department of Healthcare and Family Services, HFS, to provide information to the families about how they can enroll in that program. And then we coordinate the placement in some of those facilities. So that is our newest program. Like Julie mentioned, we also are working on a palliative care program. In conjunction with the Healthcare and Family Services, again, we are in the process of developing and implementing. Hopefully, the implementation will be soon. And that program will provide respite care, pain and symptom management, expressive therapies like art therapy, music therapy, and then bereavement support. So we've been working closely with HFS to hopefully get that program started and underway. So I'm going to talk a little bit more about our core program. So in order to be eligible, uh, the family has to live in Illinois, they have to be under the age of 21, and they have to have a medically eligible condition. Um, so that condition has to be chronic, it cannot be acute. It must qualify as one of our eligible diagnoses, and I'll show you that on our next slide. It needs to cause impairment or have a need for long-term care, require a care plan, and benefit from care coordination. So this is an example of kind of what our medically eligible conditions, kind of an overview of what those are. So as you can see, it's nervous system impairments, eye impairments, hearing impairments, craniofacial, blood disorders, orthopedic, cardiovascular, GI. So, for example, I will talk a little bit about kind of what our financial assistance can do. So, I will take seizures as an example. Seizures would be a DSCC medically eligible diagnosis for us. If the child is seeing a neurologist, and a family is financially eligible, DSCC can help pay for the co-pays for the office visit, co-pays for the seizure medications, and then potentially if there's some other kind of treatment that may kind of fall into one of our categories, we certainly can help look at that as well. Additionally, we can also help with transportation to those appointments. We've paid for things like wheelchair ramps for the home, van lifts, wheelchair repair, physical therapy. I'm trying to think of off the top of my head. Mostly medication copays is a big one as well. So our Connect Care program, again, very similar. All of the kind of policies and procedures and eligibility are exactly the same in terms of with our core and Connect Care programs. They're very similar. It's just that Connect Care participant has a Medicaid MCO. So we, DSCC, is performing the care coordination on behalf of that MCO. So really everything is kind of similar there. I will stop to say that we do get quite a few referrals for children with autism. As of right now, DSCC, we do not have autism as a medically eligible diagnosis. However, our staff has many, many resources for autism, and we hopefully, even if we get a phone call, a referral for a child with autism, we always make sure that that family is armed with a long list of resources before we let them off the phone call, just to make sure that they're getting the help that they need. Okay, our home care program. So this program provides in-home nursing to children who are medically fragile and technology dependent. In 2014, we became the single point of entry for any kid in the state of Illinois who needs in-home shift nursing. We have been operating this medically fragile technology dependent waiver, we just call it home care, since 1983. And some of you may be familiar with the Katie Beckett story. So Katie was a little girl who lived in Iowa. She, at the age of 4 months, contracted viral encephalitis. And she was living in the hospital for many, many years. And her family just wanted to bring her home. As a result of that, they went through all the proper channels, and her case actually got up to President Ronald Reagan, and he heard about Katie at the time, and he thought absolutely she should be able to live at home with in-home supports rather than having to live in the hospital. So as a result of that one case in Iowa, now all 50 states have a program like our home care program. We partner with HFS, Healthcare and Family Services, so we kind of run the program for them, but they make all of the decisions. So we provide the care coordination, we do quality assurance for the nursing agencies that we work with, but Medicaid is the one who determines official eligibility and then kind of what the nursing allocation or monthly allocation would be in terms of how many nursing hours the child would be eligible for. So in terms of eligibility for our home care program, again, has to be an Illinois resident. They must have a permanent home address. We do sometimes get referrals for children whose families are unhoused, but we do provide some resources and try to work through that with them. The child must have both medical and technology needs, and I'll talk about that in the next couple slides. The participant must be less than 21 years of age at the time of enrollment. So as long as they are approved for services before their 21st birthday, they can continue on the program for as long as they need it. So that didn't used to be the case, but fortunately now that our program has changed a little bit, and we are able to serve children over the age of 21 as long as they're in the program before their 21st birthday. Also, a child may qualify regardless of parental income. So you can have a family that makes $10 million a year, and as long as their child has a medically eligible diagnosis, a medical technology, they're medically fragile, they can qualify regardless of parental income. And then another big piece is that the child must have a trained caregiver in the home. So while we do provide the in-home nursing, we hook up families with nursing agencies that we work with. There are times, of course, when a nurse won't be there. There's a snowstorm outside. The nurse calls in sick. Maybe the nurse has a kid who's sick and can't come into work, just like all the rest of us sometimes call in sick to work. Sometimes there will not be a nurse in the home. So the family has to have a trained caregiver ready to care for that child if the nurse is unable to show up. Okay, so this is our level of care tool. This is the eligibility tool that Medicaid looks at to determine eligibility. So this is the first page of it, and a child has to have some piece of medical technology that's on this first page here. So as you can see, a ventilator, if a child is ventilator dependent 16 or more hours a day, they will score 50 points. In order to qualify for the program, a child has to score 50 points total on this level of care tool. So if the child is ventilator dependent, they automatically qualify because they have the 50 points right there. So other technology could be CPAP, BiPAP, a trach, oxygen therapy, NG tube, G tube, or peritoneal dialysis. So in order to qualify at all for the in-home nursing, they must have some kind of technology that's on this first page. So the second piece is that they have to have some kind of nursing care need. So things like vital signs instability, special treatments could include cough assist, chest PT, nebulizer treatments. Depending on the number of medications that family or that child takes, they would be awarded a certain number of points. NG, G-tube feedings, aspiration precautions, seizure precautions, which would include seizure medications. Also, and on the third page, which is the second part side of that, if the child is hospitalized or has been to the ER a total of four times in the last 12 months. So it can be a combination of 3 hospitalizations and 1 ER. It can be 3 ER visits and 1 hospitalization. Any kind of combination of 4 in the last 12 months, they would also be awarded points for that as well. So one thing that you may have noticed is that activities of daily living, or ADLs, are not on that level of care tool. We know that they are very, very important for caregiving issues and the care of the child. Unfortunately, those do not count for points on the level of care tool. Another important thing to mention is that even if there's no medical technology and a parent does wish to submit an application, we will do so. We will submit the application to Medicaid, and then they will determine eligibility. I will be very honest to say that typically when I actually don't know of any time when a child who does not have any medical technology has been approved for that program. But again, we do have some additional resources, some other Illinois waivers that we don't necessarily run for HFS, but we certainly can point the family in the right direction. So again, with our home care program, we have two different, essentially two different programs within that home care program. One is the medically fragile technology dependent waiver, which I talked about. It's that's on the left-hand side of this diagram here. So the child has to meet 50 points on that level of care tool. They do not need to already have Medicaid. They would also be able to receive respite hours, additional waiver benefits. So things like home modifications that could include like a bathroom modification, a vehicle modification, extermination services if that's an issue at the home. Um, and and like I said, they do not, as long as they continue to need the services, they can stay on the program indefinitely past the age of 21. The only thing there is a child can only be on one Illinois waiver at a time. So if a child is on our medically fragile technology dependent waiver, they're not eligible, for example, for the DOORS waiver. So that's why we also have what we call our non-waiver program. That is this is for usually for children who are a little bit less medically fragile. They do not need to meet the 50 points on the level of care tool, but they must have Medicaid already. So this would be for a child maybe who has G-tube feeds that maybe run for a 6-hour period overnight. Typically, bolus feedings for bolus G-tube feedings, we're seeing some denials from Medicaid on that. But again, that should not deter anyone from applying. We can certainly apply for the family if they wish. Another benefit from that non-waiver program is if the family does want to utilize like the DOORS waiver, the home services program, maybe the parent is being paid as a caregiver, they can apply for our non-waiver nursing and still keep that DOORS waiver. So some of our home care services, we provide care coordination to all of our families. Like I mentioned, the environmental and vehicle modifications, the shift nursing, respite care. If a child is approved for our medically fragile technology dependent waiver, they will also receive 336 hours per year of respite, which is basically to be used in addition to their regular weekly nursing hours. And those really are for the family. Say the parents want to go to the movies and they don't necessarily have or don't typically have a nurse maybe on a Saturday afternoon, they could use some additional respite hours to get that covered. Additionally, specialized training of nurses, some special equipment and supplies, family training. The nurses can go to the hospital to do some training, and then finally, child and family counseling as well. So our applications and referrals, I will make sure that you guys get this. I will put this in the chat, hopefully. But this is how you can reach us. And there are a few different ways. You can certainly give us a call. I'm going to also show you a couple features on our website. So you can certainly go to our website. It actually just got updated, I think, Monday or Tuesday of this week. So it looks a little bit different. But hopefully the functionality is still the same. So if you want to apply, you can just go to the How We Help bar across the or tab across the top. And if a family wants to complete the application, we have applications in English, Spanish, and French. And then the family can email it directly to this email here, which is dsccenrollment@uic.edu. And that actually comes directly to me and 4 of my colleagues. And we kind of triage them to determine which program might be best for that particular referral. Another way to refer is if you are working with a family and you think that they may qualify or may, be in need of our services, you can go to the same tab, How We Help, and go to the Refer a Family uh, selection here. And if you just fill out a little bit of information, then we can certainly follow up and follow up with the family, explain what our programs are, and hopefully get them enrolled. So again, our phone number, email, website, and we're on Facebook, of course, as well. And that's it.